SA Today, welcome back. Now, this week, President Cyril Ramaphosa signed into law a bill that aims to provide universal health coverage, hailing it as a major step towards a more just society. Let's welcome now Dr. Kgosi Letlape, who's the founder of the Africa Medical Association, to weigh in on this discussion. Doctor, a very good afternoon to you. Thank you so much for joining us this afternoon. So let's first get a very brief overview of how you understand the NHI to be. Is it a good or a bad move for South Africa?
Good afternoon to you and good afternoon to the viewers. We need an NHI, but this is not how to do it. This is a bad way of doing it, which will poison any future attempts of building a comprehensive national health safety network.
Mm-hmm. Why do you say that, Doctor?
Because what is being proposed is to create a third tier. We have the public healthcare system, we have medical aids. You're now coming up with another funding mechanism from the same parliament from whom the Medical Schemes Act comes from. Mm-hmm. What they should have done, reform the Medical Schemes Act so that it gives us all the things that are promised to everyone, starting with the current members on medical aids that include parliamentarians, that include the president himself. What effectively they are doing, historically, remember, current medical aids were started as white refuge to protect privileged care for white people. That has changed. Now, you don't try and transform it to open it up for everybody by creating a black medical aid that you call NHI. When you yourselves are not part of that black medical aid, when you are getting your care from the white medical aid, just for lack, to simplify it. Mm. Why are you not in accordance with what the Minister of Health, Aaron Motsoaledi, commissioned in 2016 and was completed in 2019, the health market inquiry, that would ensure that people get value for medical aids, that open it up for everybody that is employed, whether you pass laws that if you're employed, you need to belong to medical aid, just like we have UIF, but you sort out the problems inherent inside medical aid. Instead of creating a port that is going to be administered by people that have never done any of this type of work before, and all the competences and the resources that reside in the Council for Medical Schemes, in the huge administration structure that you have, in all the medical aids that you have, is now being left aside to take the control of this new behemoth into the Department of Health. With what the Department of Health has done with funds before. They couldn't even manage COVID properly. They couldn't even manage their communications budget properly. That's why you had the digital communication fiasco. You had a fiasco around COVID. We've had the fiasco in our own province when there's a good intent of saying, let's take people that are in mental institutions, put them in centers that are close to where they live. And you end up doing it the way you did Life Esidimeni with 144 deaths. This is not the way to do it. You can't have coexistence where they go, their medical aid is still administered by whoever is administering PARMED now, and they're starting an orphan medical aid, which will just be derailed. So I am for national health. I am for a unified healthcare system. But what is being proposed is not it. If it's not for all of us from the beginning, if it's not effective from the 30th of May, if it is not effective from when the president signed, you sign on the 15th, it starts on the 16th. You come up with something that when you launch, it repeals or amends the current medical scheme. They cannot exist. Now, you just ask yourself a question. If you are not on medical aid right now and you're battling with the subscription fees, And somebody's coming and saying, I'm creating a fund and you'll pay less than a third of what you're paying now. How is it going to give it a benefit
Doctor,
that you're getting now paying times? It's not going to happen.
Doctor, look,
It's not going to happen.
Doctor, in the interest of time, look, I understand you're very emotional about this. I mean, looking at the current state, and there's been a lot of comment around this, that the current state of public health facilities is not where it should be. And supposedly, this bill seeks to improve, of course, the status of those public health facilities. But government says this is for bettering the healthcare for everyone who resides in the country. And they're saying they're insistent and adamant, Doctor, that public comment as well as submissions were actually open even for objections, and those submissions have not made the bill were actually, it's not that it was not considered, but I suppose it didn't, it wasn't resonating with the majority as it is being purported out to be in public. What do you say to that?
But that is not true. Those are lies. The challenges in the public healthcare system have nothing or very little to do with lack of money. It's wastefulness. It's corruption. What do you think Babita Diokaran died for? For highlighting corruption. That's why it's not working. Doctors are not employed now. Nurses are not employed in the public healthcare system because money is not being spent the way it's supposed to be spent.
Doctor,
there's enough money. Now, let's fix all the ills, including corruption, the SABC challenges, the COVID challenges, the too many administration people, and not enough frontline workers. The problems of the public sector is not money.
All right, Doctor. Look, I'm going to promise you, or try to promise you, my producer is there listening. We're going to try and, of course, have this debate at a time that is suitable when we actually have enough time. But thank you so much for your contribution this afternoon. Dr. Kgosi Letlape, the founder of the Africa Medical Association, just weighing in on the current National Health Insurance Bill that was recently signed into law by President Cyril Ramaphosa.